tunnel is a common condition that's found in offices all over the nation, all over the world actually, and it's caused oftentimes by repetitive stress to the joint of the wrist. The person's doing the same thing over and over again, keying for instance, or playing the piano or guitar. All these things can cause carpal tunnel. But surgery isn't always the answer for carpal tunnel. We have other things that we could do centering around the muscles that attach to the wrist area. The muscles of the forearm, they allow us to do flexion and extension of the wrist, and when they get tight, they can cause a lot of stress to occur at the attachment sites of the wrist. And so the overall objective would be to free the muscles of adhesions in the forearm to release the stress at the attachment sites of the elbow joint and the wrist, because that obviously is where the muscles of the forearm attach. And so we have my muscle stripping protocol, which is to apply ultrasound to break up the adhesions within the bellies of the muscles of the forearm in an effort to free that muscle, make the muscle more elongated, and reduce the stress at the attachment sites of the wrist and the elbow, thereby relieving any pain symptoms that would arise from the tension of the tight muscle pulling at those attachment sites. The ultrasound therapy helps to break up the adhesions and promote a healing response in the muscle tissue. And after the ultrasound, we get into the muscle stripping process, which further breaks up adhesions and re-elongates the muscle fibers to allow for relief of any pain symptoms or numbness and tingling that's common with the carpal tunnel condition. Though there are a number of causes that can cause carpal tunnel from a physical standpoint regarding the carpal tunnel itself, the median nerve, and other various structures, the issue that we're addressing here that is common cause for carpal tunnel-like symptoms are the muscles and the adhesions embedded within the muscle tissue. So what we're doing right now is muscle stripping, and muscle stripping helps to break up the adhesions and re-elongate the muscles so that the muscle isn't putting so much stress on the attachment sites of the wrist area. The nerves of the forearm travel through the muscle tissue, and if the muscle is tight, it can indeed put pressure on the nerve tissue as that nerve goes to innervate the areas it's innervating. So by relaxing that muscle through this process of muscle stripping, we're able to alleviate the stress on the nerve tissue and reduce the pain. And in many cases, this is all that's necessary to help to relieve the symptoms of carpal tunnel. Not all carpal tunnel symptoms are caused by a tight carpal tunnel in the wrist area, putting pressure on that median nerve. It can indeed be just the fact that the muscles of the forearm are tight, and that is putting pressure on the median nerve. You also have the radial nerve and the ulnar nerve, but classically carpal tunnel involves the median nerve. Carpal tunnel is called carpal tunnel because you have carpal bones in the wrist that form an actual tunnel that the nerve travels through. And there are structures in that tunnel that if they become inflamed, they make the tunnel more narrow, putting pressure on the nerve as it travels through that tunnel. And so there are a number of things that doctors will do to help to alleviate that. Some of it requires drugs, some of it requires bracing, but the most non-invasive, drug-free approach is the best approach. And so that's why we do this process called muscle stripping. After the muscle stripping process, we adjust the wrist. There are actually 8 bones in the wrist that can easily go out of alignment, and that can cause pressure on the median nerve as well. Just a simple misalignment of the 8 bones in the wrist. And so a gentle adjustment to help to align those bones in the wrist will often give the relief the patient is looking for and allow that patient to live a happier life. There are a number of exercises that can be done to help to strengthen the muscles of the wrist and the muscles of the forearm. And basically, they're isometric exercises where the patient can push against pressure that's being applied to the hand in this fashion. Go ahead and push forward with your hand. Push your hand downward as I push against you. Very good. And release. And push your hand upward and release. These activities help to strengthen the muscles of the flexors of the arm and the extensor muscles of the arm. Push. Relax down and push upward with your hand. And release. You can actually do this exercise at home by just grabbing the hand with the other hand and applying pressure in this direction with this hand as you put pressure against it in a downward fashion. And that will help to strengthen the muscles of the flexors and extensors as you do both directions. Push harder. Good. So she's basically applying a pressure in this direction with this hand and applying a pressure with this hand in this direction at the same time to provide an isometric type of exercise that strengthens both the flexors and extensors of the forearm. And let's go back to the other one. Push. And that's it. Ice at home is also another good remedy for relieving pain and inflammation. So that is often a recommendation that I make to my patients that have carpal tunnel.